Hi, welcome to the clinic. How are you today? I know it's really hot out there. I can also see that you got a sunburn on your face. That must be sore. Yeah, I do understand that. I would like to ask you some questions, but while I do that, I am going to start with the treatment and put a couple of things that will give you the first cooling and refreshing feeling straight away. As you got a sunburn, we need to be extra careful with your skin. So I'm going to apply this mist. It's a thermal mist. And I'm going to apply it on your face and neck straight away. Is that okay? Let me put it on your forehead, on your cheeks, on your chin, and on your neck. Let me put it also a little bit on the back of your neck. Okay. Perfect. And then I'm going to put, if you're okay, this around your neck. This is a silicone collar filled with ice. This will give you an instant cooling effect, and that's what you need right now. Okay? Let me know if you feel some discomfort, but you shouldn't be feeling any. Okay. Perfect. And I will also put this mask. We'll leave the mask and the collar on for just a few minutes, just the time to ask you some questions. This mask has been in the freezer. I just took it out before you arrived. These tiny gel balls have absorbed the cold. I'm not going to put this side of the mask on your face because that could be a bit too cold. I'm going to put the back, which is soft, and it will release the cold slowly. It will be pleasant. Are you okay if I put this on? And then I'll ask you some questions. Yes, it's designed for you to be able to speak and breathe, so I don't think you'll have any problem. Okay? Okay. So let me open the straps and apply the mask on you. Okay? All right. Let me now sort the straps on your back. How does it feel? Is it too tight? No? Okay, perfect. Okay, let me press gently the mask on your face. few questions. Okay. So, what type of skin do you have? Sensitive? Normal? Okay, quite sensitive. And when did you get the sunburn? Yesterday. Okay. Were you wearing a sunscreen? No. No. Sunscreen. And for how long have you been under the sun yesterday? Around an hour. With no sunscreen. Okay. Okay. And how do you feel? Do you feel a bit better from yesterday or worse? Okay. Okay, that's enough. I would like to suggest you always wear a sunscreen. Even when the sun is not up, it's a good habit to wear sunscreen every day, in every season. You can wear a sunscreen on its own and then your face cream, or you can buy one of those creams that have already sunscreen in them. Please, if you can stick to this, that will be a beautiful habit and you will thank yourself for doing that. Yeah. Yes. Okay, perfect. Thank you. So I'm going to remove the mask now. Let me open this first. Perfect. And I'm going to remove the neck color. Perfect. Do you mind if I touch your skin gently? Thank you. I just want to see which areas have been more affected. I can see you have some patches. Is it painful? Okay. So I'm now going to put some aloe vera on your skin. Then I will use tools to give you more cooling effect. On your forehead. Your nose, underneath your eyes. little bit on your neck. Just like that. Okay, perfect. Now I'm going to be using this cry stick. You can see they're very cold. They've been in the fridge and then put in that ice bowl to keep them really cold. I'm going to massage your face with this and allow the aloe vera to penetrate in your skin. Your forehead, underneath your eyes, which is one of the most delicate areas in our face. Okay, around your nose and all your cheeks. Do you like it? Okay. And on your chin. Don't worry, I will be covering also your underneath nose and above your lips. As I can tell, it's probably the area that got most affected by the sunburn. But these tools are a bit too big, so I use another tool. Okay. And I will also do your neck. On the side and the back. And on the other side. Okay, perfect. Now I'm going to use some smaller tools. These ice globes. These are very cold. Yeah. Yeah, that's right. Around your eyes. cheeks with movement, bottom up, this side, and underneath your nose and above your lips. Okay. Your jawline. And your neck again, as we did before. The side towards the back, and on the back, and on the side. To the back. Okay. Perfect. Your skin looks already better. Okay. Can I touch your skin again, please? Thank you. Let me see. Some areas are getting better already. Some others are still, unfortunately, affected by the sunburn. But it will take a little bit of time. But with this treatment, it will get better quicker. And at least you do not have the feeling of being hot and burned. You can have a bit of relief. Okay, looks good to me. Now, I'm going to apply some serum, a very delicate one, of course. I'll put it on your forehead. And on your cheeks. Your cheek. And a little bit on your chin and jawline. And just a few drops on your neck. Perfect. And now I will be distributing the serum with this tool. Again, this tool is cold. It's put in the freezer. And with the movement of the roller, I will spread the serum so that it will be absorbed by the whole skin. Okay. Forehead, circle motion, movement. And then your eyes. So how was your day today? Very busy at work. It must be difficult to work and focus when you are not feeling very well yourself. Yeah, this heat is pretty bad on its own. Never mind having a sunburn too. Take your time. After this treatment, you'll feel so much better. You'll have a good time. I'll sleep. Tomorrow, you can see your skin will be better. And your neck. And on your side. Back of your neck. And this side too. Perfect. Okay. Perfect. I'm going to use this tool just underneath your eyes. These two balls. Will reach and massage perfectly the skin around your eyes. This tool is cold as well, as you can feel. Okay. And underneath this. the last step, I'm going to apply a cream. Very rich and nourishing. I will apply it all over your face. This cream, it's the best last step of this treatment. It will nourish your skin incredibly. It has a beautiful soft texture. Yeah, true. And I will then massage this cream so that it will be absorbed by your skin in every part of your face and neck. Alright. Okay, let me start from your forehead. It is a soft texture, and yes, you're right. It is a silky texture. You're right. Okay. The side of your nose, and of course all your nose. And your eyes. Mm-hmm. Perfect. Now we're going to do the other side. Now your chin and your jawline. And your neck. I am applying a lot of this cream because even though it's very very rich. It absorbs incredibly quickly, and your skin now needs this. I'm going to put it on the back of your neck. So yeah. Okay, and on the sides of your neck and back. Perfect. Yes. Okay. Perfect. The last step of the treatment will see me using this tool. Again, very cold. Kept in the freezer with a flat surface. I will massage all your face with it until the cream is fully absorbed. So let me start on your forehead. This flat tool will kind of compact your skin. When you get a sunburn, the skin breaks and you can see creases that become later on fine lines. So this cryotherapy tool is particularly important to compact the skin. So that we will prevent these creases to become worse. How do you feel? I'm glad you feel relaxed too after a long day of work. It's so hot and I'm in a sunburn. I think that's the perfect clothing on a Friday. Then you can enjoy your weekend. Do you have any plans? Oh, that's lovely. Nice. We'll be back on Monday. Alright. It's a long weekend then. Perfect. I really hope that this treatment will benefit you and you will see the results. Get better, relaxed, so you can enjoy it without worrying about anything. what I would suggest you, if you don't mind, it is to bring with you some rich and nourishing cream. Apply it on your face every day, morning and night before going to bed. Please don't forget to apply this sunscreen unless the cream you have already contains sunscreen. But please don't forget that. And bring with you also a nice lip balm. Keep okay, the cream has been absorbed fully. Just touch the skin just to make sure. Yeah, it is dry. And fresh. Yes. Perfect. Perfect. I think we are done. Right. Thank you very much for coming today, and I'll see you soon. Enjoy your weekend. Bye. Hello, welcome to my office. Please have a seat. I'll be your doctor today, and I will carry out your ears, nose, and throat checkup examination. Before we start, do you have any concern you want to raise, or anything that has changed since your previous checkup last year? No? Good. Let's begin the examination. I'm now going to examine your nose. I will be using this tool called speculum to dilate your nostrils so that I can have a better look. Can you lift your head up, please? Thank you. Let me look
Yes, perfect. I want to have a feel when the muscles are stretched. Okay. Yeah, very good. Can you tilt your head on the system and create infections that are very painful. Okay, so I can see there is a little bit of wax, which I'm going to remove now. I will be using this tool with this tiny tip, which is like a little
Hi, nice to see you again. How are you? Good, I'm very well, thank you. We met before when you came to undertake the patch test to determine if you were a good candidate for the tattoo removal treatment. And you were. So today you're here for the actual treatment. But before you meet the physician that will carry on the work, I would like to apply some topical local anesthetic on your face, as your skin resulted a bit sensitive to the laser. Nothing to worry about, but this will reduce pain and discomfort that you might experience during the treatment. Is that okay? Good. I'm going to apply now, and then you will meet the physician. Okay, let me wear the gloves. Let me apply it on your forehead. Okay. And on your left cheek. I don't want to go too close to your eye, but you have them in the teardrop tattoo. I need to try and cover them as much as I can. Okay, perfect. Nothing on the chin and your cheek. We'll leave it on for just a few minutes, and done. You'll be able to have the treatment. Okay, I'm going to cover your 3 areas with cling film to prevent drying. Perfect. And then your cheeks. Okay. And the other cheek. Perfect. Okay, if you can now go to the waiting room, you'll be called by your physician. No problem at all. Thank you very physician, and I will carry on your tattoo removal treatment today. How are you feeling? Good. I can see you had the local anesthetic applied on your face. How does it feel? Any burning sensation, tingly sensation? No, good. Perfect. I will be removing them right now. Let me take this off. Okay. Perfect. And the one on your forehead. When we spoke over the phone, I have given you some information about what we are going to do today. But I'm going more into that in a moment. I mentioned you some important things to avoid prior to this treatment. I have a list here, so I will ask you a few questions if it's okay with you. Perfect. Okay, so did you avoid tanning or sun exposure? Yes. Did you avoid applying fake tan? Yes. Did you avoid using any oil or moisturizer today? Yes. Great. Did you avoid using any makeup today? Yes. Great. Now let's talk about your tattoos. Where did you have them done? Yeah. Yes, that too. Okay. Okay. How long ago you had your latest tattoo? Was the tattoo made by an amateur or professional? Okay. Have you undergone any prior tattoo removal procedure? No. I will now explain to you a bit more in depth how the treatment works. Then I will evaluate your skin. We can move over there where the bed is. You can lie down and I'll be there in a second. Thank you. How do you feel? Are you comfortable there? Perfect. I will now explain you a little bit more in depth how the laser tattoo removal works. This is the machine I will be using. Laser works by targeting the pigment in the tattoo with the correct wavelength for maximum absorption. Each color requires a different wavelength to work effectively. The high power of the laser and short pulse duration shatters the ink into tiny particles, small enough to then feed into the bloodstream. Over the 8 weeks or more Following the procedure, the white blood cells clear up the debris from the broken ink naturally through the body. This clears the way for the next layer underneath to be seen and hit by the laser. And it is repeated until the ink is fully clear. Smaller tattoos require fewer pulses and larger ones require more. In either case, the tattoo requires multiple visits for treatment. Typically, you will need 6 sessions. After each treatment, the tattoo should become lighter. Why does it take more than 1 session to remove a tattoo with a laser treatment? It takes more than 1 session to remove a tattoo because when you got your tattoo artist applied the ink in layers. Because laser breaks the ink pigment into smaller particles, it then takes some time between sessions for your body to flush out the ink. Your skin also needs time to heal. What are the different skin types? In laser treatments, we use the Fitzpatrick scale to select the skin types of the client. This is determined by the amount of melanin in the skin and the exposure to UV light, the ability to tan. Using the scale greatly helps in understanding the skin's ability to react with different wavelengths and allows us to create personalized treatment. The fairer the skin type, the less melanin, therefore the more laser light is reflected and not absorbed. Lower melanin levels greatly reduce the chance of side effects such as hypopigmentation, which is permanent skin lightening. This is why you should also be at your natural skin tone and not tan when undergoing laser. Will laser completely remove your tattoos? Each person tattoo removal process is different, but in general, yes, it will remove fully your tattoos. Some colors may be easier to remove than others. Black ink tattoos are generally easy to treat. Green, blue, and purple ink is very treatable. Typically, it is only suitable for Fitzpatrick 1 to 3, which is exactly the range of your skin tone. These tattoo inks aren't as deep into the skin as the black ink, so the ink goes much quicker than black. In terms of red, orange, and yellow ink, we can treat them. However, yellow is almost irremovable just because it's so light of a color it's barely able to be picked up on the laser. Again, red color is usually only suitable for Fitzpatrick 1 to 3, and that's because it's not safe to do on darker skin. It's too aggressive. Now, white ink is pretty much irremovable just because it doesn't have any color to it. Tattoo removal on white ink is unpredictable at best in some cases. White tattoos can also oxidate and become darker, gray, and at the point there is pretty much nothing we can do with it. I hope this explains a little bit more how the treatment works. Do you have any questions? No. Perfect. I will now examine your skin and then I will take a photo of them to record the results of your procedure. Okay. Let me have a look. You have 5 small tattoos on your forehead. One, two, three, four, five. Yeah. And then you have one big and four small teardrops on your left side. Okay. Nothing on your chin. And one medium and two small on your right side. Okay, so the majority of your tattoos are black, except from the 4 teardrops that are blue. And the medium one on your right side that is colored, but it is completely treatable. Perfect. I'm going to take a picture. Look straight ahead. Perfect. Take another one. Closer. Perfect. Now we can begin the treatment. I'm going to put your hair back so they would interfere with the treatment. You will need to wear these protective glasses during all treatment. So let me put them on. Alright. Perfect. And I will also use my protective glasses. I'm going to turn off the light to make you feel more relaxed. Okay, we can start. Please let me know if you feel any discomfort at any time. Perfect. I'll start with your forehead.
4 done. Now I'm going to treat the 1 big and the 4 small teardrops on your left side. Done. How do you feel? Do you feel any pain? No. Excellent. Now I'm going to treat the medium one and the 2 small you have on your right side. Perfect. Done. Yes, pretty quick. Painless, so yeah, I'm glad. So you don't have to worry about the next sessions. They will all be like this. Perfect. I'm now going to apply some protective bandage. one will cover the medium and the two small. Okay. And for the 4 teardrops, we'll use one tiny. Just like this. Perfect. Now I will give you some information about the aftercare. Okay, so in terms of aftercare, immediately after the treatment, you can apply a nice pack to soothe the treated area for the first 3 days. Cover the area with a layer of antibiotic healing ointments. Keep it bandaged with sterilized gauze. Don't apply any other creams or makeup to the treated area within the first few days. You can remove the bandage after 3 days, but keep the area as clean and dry as possible. You may also apply Vaseline or hydrocortisone cream have any doubt or concern, please contact us. We'll be happy to support you. Here. It was an absolute pleasure seeing you today. I'm looking forward to the next session. Thank you. Have a good day. Bye. Hi, I am calling about your appointment today. I was wondering if you could come a bit later, as I'm running behind schedule and I don't want you having to wait. You don't have time today, I see. Oh, that's great. Yeah, if you can come tomorrow, I have some free slots. Would it be okay for you to come around 2:30? That's absolutely perfect. Thank you very much, and I'll see you tomorrow. Bye. Yes, please come in. Hello, welcome to my studio. Nice to meet you. Please have a seat. You're here today to get your hands checked due to some numbness and tingling. Is that correct? I'll get to that in a moment, but first I would like to ask you a few questions so that I can understand better the origin of your symptoms. Okay? Thank you. How long have you been experiencing these symptoms for? A few weeks? And does it affect both hands? the left one? Are you left-handed, right-handed, ambidextrous? Right-handed. Does it affect the whole hand or just some fingers? The little finger, ring finger, and sometimes the thumb. Okay. Is there a specific time of the day where this happens? Usually in the evening. Do the symptoms appear while doing something specific? While using your phone? Okay. And does this happen while not using the phone as well? Like at nighttime or in the morning upon waking up? No. Does this happen while make phone calls as well? No. Which position are you in when this happens? Are you standing? Are you lying? While lying on the sofa or in bed? Interesting. So I assume that if you're lying on the sofa or in bed, this is the position of your arms while holding the phone or the tablet. Is that correct? Okay. Very good. Thank you for being so detailed, as this is important for me to understand what causes this. Based on your answers, I would exclude a carpal tunnel syndrome, and I think this has more to see with the cubital tunnel. And this is quite common nowadays. This because nowadays people spend a significant amount of time on mobile phones or tablets. Most people tend to hold these devices in the same position for a prolonged period of time, and they tend to have their elbows flexed. This position can put a strain on the ulnar nerve as it travels around the elbow. I'm going to show you how this works using some pictures. So the ulnar nerve runs in the forearms, and it is the largest nerve unprotected by muscle or bone in the human body, so it is more prone to injuries. This nerve is directly connected to the little finger and the ring finger. This flexed position increases the tension and pressure of the ulnar nerve at an area around the elbow called cubital tunnel. This may then result in numbness, tingling, or a burning sensation along the outside aspect of the forearm, as well as the small and ring finger of the affected side. You can see this better in this picture. This is how it gets dropped. So I will now run some checks to assess the severity of your situation. Depending on that, there might be further treatment that you may need, but let's have a look. Okay. Can you please put both hands on the table? Do you mind if I remove your rings? Thank you. Perfect. I'm now going to rub these tools gently on your arms. Can you tell me if you feel them in the same way on both sides? Mm-hmm. And on the forearm? Good. And if I rub your hands? Same? Okay. I'm going to turn your hands. What about on the palms? Same. Okay. Okay. Now I'm going to use these tools on the outside of your hands. How does it feel? Same. Okay. And here. A little bit less on the left hand. Okay. I'm going to turn your hands again. I'm now going to touch each finger and you tell me if you feel some discomfort. No? No? Okay. Okay, no discomfort. I'm now going to gently bend your fingers. Again, you let me know if you feel some discomfort. little bit of discomfort on the left hand. It's not painful though. No, okay. Okay. Upon checking your situation, I'm pleased to tell you that it is not something concerning. The fact that the left hand is affected, it's because being right-handed, you tend to do everything on your phone or tablet with your right hand. This means that you're moving your right hand and its fingers often, and they don't fall into a prolonged period of inactivity like your left hand and its fingers. I'm now going to treat the affected hand, and you will benefit from it straight away. If this happens again, my recommendation is to avoid prolonged and extreme flexion of the elbows. It is also a good practice to alternate hands as often as possible and to move your fingers and thumb periodically and avoid strong or tight grip of the device. So your right hand is perfectly fine, so I'm going to treat the left hand. I'm now going to use this tool and massage your elbow to release the pressure of the ulnar nerve. Just like that. Is it painful? No, good. Okay. To your forearm. And on the palm of your hand. Okay. Now I'll be using this tool to massage each finger. Is it pleasant? Good. I'm focusing particularly onto your little finger and ring finger. would like to also treat this area. Okay. Now I'm going to gently apply pressure on some pressure points of your hand, known in acupuncture and reflexology to be powerfully sensitive body parts that can help relieve pain, establish balance, and improve overall health. The first pressure point is here. Then here. Okay. Then we have 3 points here. This is one. This is the other. And then this one. I'm glad you find it pleasant and relaxing. Okay, the other point is over here. Mm-hmm. Here. Perfect. How do you feel? Good. Good, I'm glad. So, the treatment is now finished, but before you go, I would like to show you a few exercises that you can do at home to relax your hands and improve muscle strength. They are very easy and also pleasant. I will put your rings back. And the other one on your other hand. Thank you. You can use these pouting balls. You put them in one hand only, like this, and you rotate them. In circular motions, using your hand muscles, just like this. This is a great exercise. Okay? Then, similar to the bowling balls, there are these quartz balls. They're a bit bigger, but when you get used to the smaller, you might find it easy. And you rotate them. Okay? Okay? You can use these wooden hexagonal acupressure massage balls. One in each hand, and you move them around, applying a gentle pressure in different places of your hand. Just like this. This is also a very effective exercise. Okay? And last, you can use some stress balls. One in each hand. And you squeeze them. Just like that. You can find them in loads of different colors, materials, and different levels of resistance. Just like this. Okay? Is there anything you want to ask me? Is everything clear? Yes? Good. So, thank you for coming today. If you need anything, just give me a ring. Thank you very much. You too. Goodbye.